So some of this we went over already. It's the idea of having short-term, intermediate-term, and long-term milestones in each of the categories you want to succeed in. Look at activities as series or parallel. So for instance, you may want to be, let's say, an educational administrator, let's say residency director of residency program, and have a clinical area of expertise in treating some disease or some group of patients. Well, a lot of the things in those categories you can be doing at the same time. Okay? There are other things that have to be done in series. So if you want to be a department chairman, you're probably going to have to be a committee chairman first, and maybe an associate division chief, and maybe then a division chief before moving up. So knowing what you can do in parallel is helpful in maximally utilizing your time. However, knowing what has to be done in series is absolutely crucial, because you can't start on step 2 until you're done with step 1. Okay. Talked about scheduled reevaluations. I think once a year. Again, once you've done this for the first time, it probably takes you 15 or 20 minutes to reassess each year. You send the kids to the movie theater and send your spouse out shopping or something, turn off the TV, and look through your calendar and look at your career development plan from the last year. And say, did I achieve the things I wanted to? If not, what do I have to do differently now? Where do I have to redirect? Or even, gee, I thought this was a really great goal for me, but now I found this other area that I'm really interested in, and that's what I want to do for a living. And then you reassess and replan. Okay. And then the models, or the tools asked for by our audience member, there's no set single model to use, but you want to create one that has the categories that are relevant to your specific career development. So let's look at a couple. So this is kind of a generic way. This would be a way to start out. Let's say you're doing some work in all 4 major areas, in clinical education, research, and administration. So what might be your 2-year goals in each of those fields? 5-year goals, 10-year goals, or long-term goals. As an example, maybe your clinical work intramurally might be to just build your own practice over 2 years. So you've got a good patient base to do whatever else you want to. Extramurally, maybe you want to get on a committee in a professional society where someday you might be asked to write a guideline or to help with a best practices document, or somewhere where you can really influence how clinical care is delivered in the country. Same things for education and research and administration. Again, I'll give you some examples of this, but this would be kind of a generic career development template. Let's say you're going to be primarily an educator. Yes, you're going to do other things, but your focus is to be a professional medical educator. So this would be an example. Obviously, you're going to have more categories and more things under education than you will under the others. But you might divide your clinical work in what you're doing in an inpatient setting versus an outpatient setting. Or if you're a subspecialist, what you're doing within your subspecialty versus what you're still doing in general medicine. In education, you may, if you're a busy educator, and I think most of us are, you're probably teaching students and residents, sometimes fellows, as well as your colleagues, and doing it locally as well as at regional meetings or national meetings like this one. That might be a way to further spread out and add detail to your educational goals. In research, hopefully if you're an educator, you're doing education research. Dr. Darden's going to explain to us how to do that. But also, a lot of clinician investigators will be involved in multi-center trials in hypertension or diabetes care or some other things. That may be your research chunk of your career development, which will also help towards promotion and tenure. And then maybe in the administration, you may be on one hospital committee and one university or departmental committee. If you want to move up, you might have your 5-year goal might be to chair that committee or to get on another committee that you're not eligible for now. Again, just examples. If you want to be an investigator doing mostly clinical research, then this is a template you might think about. So in clinical, what are you going to do? Well, you got to make sure you're hitting whatever goals are set for you so you can get a paycheck. All of us now have some significant portion of our salaries dependent upon clinical productivity. I think personally that's a good thing. But what are you hoping to achieve? So you may very well have either collection rates or billing rates or work RVUs or some other measure of productivity that you are expected to achieve from your boss. So these, you might fill in that row with those goals. Maybe you're primarily an investigator, you do want to teach, but you really don't want to get involved in developing curricula or administering programs or that kind of thing. So maybe your first 2 years might be to get comfortable with the teaching environment and your learners, and then maybe to put something together where you can have learners come into your clinic or into your setting and even create a little bit of an elective for them. In the research area, though, now the clinician investigator should have a lot of things going on. Multi-center trials are out there. A lot of clinician educators, as well as clinician investigators, do multi-center trials. They're relatively easy. There's not really, you don't even have to know a whole lot about research to do them, but it will meet research requirements at many schools for promotion. You may have collaborators. Let's say you have an area you're interested in, there's no real expert at your institution, but let's say for the first couple of years you're going to start to build your own reputation delivering patient care, maybe writing some articles, and then you think, well, by the time I'm ready to do my first research trial, I want to be able to work with Dr. So-and-so at this center because he or she is a real name in the area. And anything related to grants, funding that comes in. The coins of the realm will always be publications and grants, no matter what else anybody else tells you. But as an investigator, if that is your job description, you'll have a greater emphasis. There will be a greater emphasis on you actually bringing in funding from outside your department, from other sources. And then administration, maybe your choice of a committee might be to be on the IRB or to be involved in research administration. That way you're meeting your citizenship requirements for your department or school, but you're actually still involved in research and looking at research protocols. Another way to do this is your institutional promotion requirements. So typically people go up from, if you start as assistant professor, somewhere between 5 and 7 years you'll be eligible for associate, usually another 5 to 7 years for full professor. So you can use those as the breakpoints. What do you want to have done before you're up for promotion to associate, or promotion to full professor? And these will be very specific to what you're doing, what committees, directorships, special projects under the citizenship area. And as you move up in academic rank, the expectations will also grow. So you can't be sitting on the same committee you were 12 years ago and expect that to count towards getting you a full professor appointment. On your clinical service, by this point, and as you're looking down the timeline of your career, this idea of developing an extramural or national reputation is really, really important. I've never seen any school's promotion and tenure criteria that didn't include some expression of this. Okay? And that's something else. You can join a lot of societies by writing a check. That's not national recognition. When you're asked to chair a committee or be in a leadership position or produce a product for that organization that will be their official recommendations on patient care, those are leadership positions. Publishing in peer-reviewed journals, especially larger ones with national exposure. Even reviewing for national audience type journals or international journals. Those can always help there. Education, again, lots of different options. You might be doing student lectures, you might be focused more on GME in teaching your colleagues and those in practice around you, education committees, etc. So these are just a couple of examples of potential templates you could use. Okay. So I'm going to touch on, just show you how you might populate these. So let's say your major role right now is being a clinician. Okay, so what would be reasonable goals? You're just starting out, you just arrived on campus, it's July 1st, you got a shiny new clean ID card and a key that looks really good but usually doesn't fit many doors. And you say, okay, so what am I going to do first? Okay, well, reasonable to your goal. If you have an RVU goal set, you may agree with your chair and say, well, I will reach 75% of this within the first 2 years. Okay, that might be reasonable. You certainly want to pass your boards. Right? We don't put it off. We don't say we'll study later. We take our boards and we pass them, so we don't have to think about them anymore. You may want to meet all the support people. I found this particularly useful when you go to a new institution. You make the time to find out who's in charge of medical records and who does this for MAS and who does that for human resources. You show the interest in them, which virtually no doctors ever do. They will be your friends for life. It's like feeding a stray puppy. They will, whatever you ask them to do, they're likely to step up. And you'd be surprised how often you don't even hear about things because some kind person who you showed respect to decided they would take care of it and not bother you for it. And you may already have an idea of what sort of committee you would like to be on if you have a particular goal. Let's say you have a pharmacy background or an interest in drug development. You may want to be on P&T committee or medical utilization committee, something like that. As you get further out in your predictions, your goals are going to be less specific. They're going to be broader, but they're still going to be kind of following along the same line. So the idea of the rows on a career development plan is that that's the direction you're going, but these are going to be steps that will take more time to achieve, or maybe preliminary achievements before you can be eligible to do those achievements further on. So for 5 years, it might be to reach or exceed your RVU or collections target. I think most chairmen would say, yes, you're going to do this by 5 years. Maybe to establish solid referral lines in neighboring markets. Let's say you have a subspecialty, like my area is cardiac disease and HIV patients. So I'm building a referral base now to try and get patients from other HIV centers in our region to come to us for cardiac care. Maybe you want to, by this point, you're ready to chair one of those hospital committees, particularly if it's an area of expertise. A lot of people are into patient safety, quality improvement, high-value care. If that's going to be a major scholarship area for you, then maybe having a leadership position on one of those committees, either for your department or your hospital, would be a good idea. And probably by 5 years, if you're interested and you work hard on it, you could certainly achieve that. Okay, by 10 years, what would you think you want to do? Your practice by this point is more than established. It's actually established within the first 3 or 4 years. But if you want to really take something to the next level, perhaps by this time you want to be thinking about actually establishing a center of excellence in this area. You may want to get your referral lines to really expand out so you're getting patients from all over your state, or even multi-states if you're in a specific geographic region. And by 10 years, gaining that national recognition through your work with professional organizations such as this one. So this would be a leadership position, a major committee chair, a writing group chair, something like that. Reasonable goals along the clinical scholarship axis. And then your long-term, you might want to be the world expert in something or other, write evidence-based guidelines, which are an incredible amount of work, but very, very fulfilling if you get asked to do that. But it's an incredible amount of work. You may want to be on the editorial board, an associate editor, maybe even an editor-in-chief of a major journal in your area. So these are just some examples of goals you might set along the clinical axis. We'll touch on a couple of things for education. So in a similar example, let's say some of your career development and some of your goals are going to be in the educational arena. So maybe in the first 2 years, you might want to put together and complete and be ready to administer a teaching workshop series. Maybe you bring some expertise from your training or from a previous job in, say, faculty development or in feedback and evaluation or something like that. Put something together, you're helping to train your colleagues and establishing yourself as an educational leader kind of right off the bat. Doing something that makes students and residents want to work with you, like having a unique rotation or being particularly good in a given setting where you concentrate on it and then people say, oh, I want to work with Dr. X in that really subspecialty clinic because it's got such a good reputation, or this is a great person to work with. And then I've never gone anywhere where there was a need for more stuff in education. New teaching modules, new organizational structure, new documentation tools. I mean, it never ends. And if you ever do think it's almost ended, just write to the ACGME. Okay, they'll send you like another 500 things to do by Tuesday. By 5 years, you might want to have a formal role in medical education. So maybe be on a medical student education committee, or maybe an associate program director for a residency or a fellowship. You may want to be on the departmental education committee. This gives you an opportunity to kind of expand your educator expertise beyond that narrow area that you might be working in. So if you're an APD for a residency, this will give you a chance to also influence student education, or maybe fellow education, or different tracks within your residency. And committees are always looking for volunteers. You know, everything you do at a national organization, you are doing as a volunteer. Okay, we are here today volunteering our time and effort. So most people don't say no. They may not give you exactly what you're looking for right at that time, but it's like manuscript reviewing. If you can review a manuscript, there's not a journal that will turn you down. Maybe New England Journal, a couple of the real top ones, but you are volunteering your work, so don't be hesitant. When a organization puts out a request for volunteers to sit on this and that, throw your hat in the ring. If it's something that interests you and you think you can further your career, give it a shot. The worst they can say is, thank you, we had a lot of great applicants this year, but we'll keep your CV on file for the next opening. That's the worst that's going to happen. Okay. So 10 years as an educator, you may want to have a formal part-time educational leadership role. So this would be being a program director, being a clerkship director, maybe being a senior medical student director for your department over all the elective rotations that the seniors get. By this point, you're going to have your career as an educator, then you really need to have a major role in national nonprofits. Whether that's purely in education or in a nonprofit that does a lot of education where you're in a leadership role. So that may be one of the officers, it may be on a board of directors or on a council, education council, certainly on things like program committees or committees that are writing durable documents like board review books. And maybe you might even think about, by this time, will a master's in medical education be helpful for you? Advanced degrees is another whole talk that we won't be giving this year, but one word of caution: know exactly what that degree is going to do for you before you put in the time, effort, and money to get it. Okay? 3 more letters after your name simply makes your signature line 3 letters longer. Okay? So it's got to be something, especially at this point when your time and effort is so dear to you, that you know, if I get this degree, then I will get that job, or then I will be eligible for that position, or then I can be eligible for this grant and then fund the research I want to do. Don't go into it saying, a master's degree in education would be good because I want to be an educator. Okay, you'll regret that, and so will your checkbook. Okay, I have similar outlines here for research and for administration. They will all be available on the website, and but they all follow the same kind of concept. So, summarizing both of these half-hour sessions, the fundamental operation you want to do is create a thoughtful, thorough assessment of where you are, where you want to go, how to get there, and what you need to do to get there. Those are the 4 steps. Make informed decisions. That sounds silly to say to a bunch of doctors. I cannot tell you, I was vice chair for faculty development for some period of time. Be amazed at how many people, when you ask them, well, what's in your contract? I don't know. I signed what was put in front of me. Literally, half of the junior faculty said that. Those are not informed, deliberate decisions. If you wouldn't act that way in the grocery store or at a car dealership, you really shouldn't be doing it with your career. Reevaluate, adjust, be willing to say, and be comfortable in saying, at that time I made the best decision that I could, but things have changed, I've changed, the world has changed, and now I want to go in this direction, and I think that's what will make me happy. Do not lock yourself into decisions you made too early in your career. We have enough 40-something-year-old doctors with depression and burnout and all kinds of other things. You got to be willing, sure, it's some risks and there's some price to pay. But if you identify something and you say, gee, I'd love to be spending my time doing that instead of doing the same thing I've been doing for 15 years and do it for another 20 years, you're much better off making the change and paying the price for that. And then the written plan, I call them career development plans, but having something in writing that you can actually look at, you can hold in front of you, that other people can look at and say, gee, you're overlapping these 3 things, where you can get the time to do that. That simple visual can go a really long way in helping you make more intelligent decisions of what to do, when to do it, how to proportion your currency, which is your time and your effort.